Welcome to Community Conversations. I'm your host, Steve Mantis, and my guest today is Doug Moynihan, the CEO of Atikokan General Hospital. Welcome, Doug.
Thank you, Steve. It's a pleasure to be here.
So, Doug, let's talk a little bit about your early days. Give us a little, where do you come from and how did you end up in Atikokan?
Well, that's an interesting question. I come from Ontario, actually, which is good because we're here in Ontario now, but I've spent quite a bit of time in Alberta, Manitoba, doing different work in human resources was kind of my history, my background. And I didn't come into healthcare until just about, maybe 15 years ago.
And I mean, we've known each other for years, and I've seen you take on different jobs in different industries, and you go, wow, how does he do that? How, like, wow, this is, I mean, it's definitely lifelong learning.
It is. You know, I spent, as you know, quite a bit of time not avoiding healthcare, but looking at healthcare from other organizations, from the perspective of organization effectiveness, for example. I had the pleasure of working with Kraft Foods and with Syncrude and the oil sands. And I always looked at healthcare thinking, my gosh, just like President Trump has said, who knew healthcare could be so complicated? And now that I'm in healthcare, I wished I'd started many years ago because it's really, truly the best challenge that I've ever had.
Oh my gosh. So, you know, we're in our senior years.
Yes.
And it sounds like you're still relishing the challenge.
Well, I am. I mean, you and I are about the same age, and we're at that leading edge of the baby boomers. And I can't remember the exact time when you and I were sitting on the rock on the Lake Superior when we were in our 60s, or in the 1960s. And we both were thinking, my gosh, you know, there's a lot of problems in this world, but when we get old, we'll solve them all. Well, here we are. We're old, and the problems have not gone away. So,
well, yeah. I feel like I was so much smarter then than I am now.
Exactly.
I feel like I've just my knowledge base. Well, it's increased. I realize I know less and less of what is possible to know.
It's what happens, with life.
Well, let's talk about your time now in healthcare. So you first started up in Sioux Lookout, is that right?
I did, yes. I started there, and I was fortunate enough to help them build their new hospital. And the challenges of building a hospital, it's one of the most difficult construction to actually finish because of the different codes and the importance of infection control. And you know, our hospitals today, they're the place where we, unfortunately, almost everybody ends up in, but you want to try to avoid a hospital as much as you can during your life. But in Ontario, I must say, we're really fortunate to have some of the best hospitals in the country.
And challenges, I remember, you know, I'm not that involved in healthcare, but in Sioux Lookout, there is a whole interesting dynamic that serves a huge part of the province that's quite remote, a number of First Nations that relate to healthcare in Sioux Lookout. And I understand you were part of some kind of innovative programming there too.
Well, I don't know about that innovative programming, but the challenges of the Sioux Lookout Manoyawan area are huge. They have a what we call a collection area of all of the citizens that live up in the north that go right up to Fort Severn. There's 28, as I'm sure your listeners are aware. There's a lot of different First Nations communities, 28 in the north. A lot of the patients for Manoyawan are flowing in, and they don't have their family or supports in the community. So it's quite a challenge to deal with. There's language issues that they have to do, and on top of the complications of healthcare. So it's quite a high-performing organization in Sioux Lookout.
And when did you make the transition to Atikokan?
Well, I just started in Atikokan 5 years ago. It's a wonderful community just 200 kilometers west of here. We have a 41-bed hospital, and also fortunate enough to be managing a small extension that we're adding on to the long-term care. So we have long-term care as well as the emerge department in the hospital.
Are they both like on the same property? It's all the same building, or?
It is, yeah. It's quite a challenge to be managing both because there's the Long-Term Care Homes Act, and that's quite a different act that we have to comply with, which is important to give good care for our elderly citizens.
So as a CEO, you've got like everybody in Atikokan you got to look after, and then all the mechanisms of relating to your funders, your provincial and federal, your unions, your employees, your patients. What's your healthcare like? What's your pulse going like? Oh my gosh.
Well, you know, I'm healthy, but you know, things happen to all of us as we get into this age. You know, the challenge. I'm really fortunate. I've got an excellent team in Thunder Bay, or in Atikokan rather. Many of the professions are governed. There's what's called regulated professions. So the X-ray technicians and the lab and the pharmacy, the nurses, of course, the doctors are all working together collaboratively in our community to provide the best health care. That's one of the topics that we might talk about, is how Atikokan is but a small operation within the larger context of Ontario. The Ontario Ministry of Health and Long-Term Care is a mammoth organization. So the challenge is to be able to be responsive on a local level. And so a couple of years ago, you may be aware, there are these 14 different geographic areas called the LHINs, Local Health Integration Networks. And so in our Northwest LHIN, we go from the Kenora, or from the border with Manitoba, over to Manitowaj, and from Fort Frances or Atikokan right on up to Fort Severn. It's a huge area.
So like half the province.
It's actually the largest landmass, but with only 2% of the population. So the challenge is when you're sitting down in Toronto and you look way up in Thunder Bay and you say, how much money are we putting into Thunder Bay area per capita? Well, it's pretty high.
So we're getting more than our fair share, so to speak, of those provincial dollars for health.
Well, I'm not sure everybody would agree with that interpretation, but the other aspect, Steve, is that when we look at what's called population health, so what we're trying to do is really design a system that meets the health requirements of the people that live in our area. And the news isn't good for our Northwest LHIN. When we compare ourselves with the rest of the province, more of us are overweight compared to the average. More of us smoke compared to the average in Ontario, drink too much alcohol, don't exercise enough. So our health is not as good on an average basis taken collectively. So not only do we have the challenge of the transportation, which is a huge challenge for us here in the Northwest, but also some of us aren't quite as healthy as we could be.
Now, we have to take a short little break, but when we come back, I want to delve into, well, what is health? Like, what are we really talking about here is health and health care?
Good question.
Please stay with us. We'll be right back.